Meanwhile, Minister of Health, the Honorable Dr. Frank Anthony, is optimistic that the COVID-19 hospital will be ready by this week. The minister made the pronouncement following a guided tour of the Center for Disease Control and Prevention.
The tour was led by the Georgetown Public Hospital Corporation's Director of Medical and Professional Services, Dr. FAWCETT Jeffrey. Dr. Anthony explained that the biggest challenge faced has been ensuring stable electricity throughout the building. The Health Ministry, Guyana Power and Light Incorporated, and a minister within the Ministry of Public Works, Honorable Deodat Indar, collaborated in order to power up the main grid feeding the facility. The Health Minister also relayed that a second challenge, water availability, is being addressed with the Guyana Water Incorporated.
They have agreed in the interim, once we have patients here, in the interim, every day, they would be bringing water to the facility to ensure that we have adequate water supply. In the meantime, we'll resolve the technical issues. It will probably take maybe a week to resolve those technical issues with the water. And then we'll go to the normal GWI water system.
This facility, which currently holds 197 beds, will allow 50% usage during Phase 1, thus removing the burden from GPHC, allowing them to cater for more severe cases and non-COVID-19 patients.
The facility for this phase has 55 beds upstairs, 42 beds downstairs. We recognize from the numbers we have at the Georgetown Hospital that we can transfer. We're going to probably be putting somewhere in the vicinity of 30 patients or 40 patients in the area downstairs already. Right now the hospital is compressed so that we can accommodate the COVID-19 patients. As soon as we get this facility up and running, we can now try to move the patients over. So that may be another probably 20 patients, because on average every day we notice 20-something patients who are in our transition unit. So when we can bring those transition unit patients here, it will allow me to free up the Georgetown Hospital to accommodate the non-COVID patients in a better way.
Dr. Jeffrey disclosed that while the Health Ministry and the Cuban Medical Brigade have assisted the GPHC with doctors and nurses, he is calling on the other institutions to join forces with the GPHC.
We have appealed and continue appealing to the other institutions. If they have extra nurses that they can loan us, we would be really happy, because it will help us to care for the patients even better.
Dr. Anthony disclosed that the COVID-19 hospital has adequate medical staff to cater for the incoming patients. He also expressed his sincere gratitude for contractors, the GPHC, and other agencies that have recognized the gravity of COVID-19 and are working to ensure the facility is suitably furnished to house patients.
From the Ministry of Health perspective, we think that all these agencies recognize that, the emergency and the urgency that we are facing in terms of ensuring that we have this facility ready for our patients, and they have gone that extra mile to ensure that they work closely with us for this facility to be up and ready. So we are extremely grateful for the cooperation.
For InfoHub, Gavin Lewis.